ladies and gentlemen, it is almost time to hit the greens. Golf season is upon us, but if you suffer from chronic pain, you might not be so excited about it. Here to tell us about a non-surgical approach to care is Dr. Richard Carpenos and his patient, Greg Cowan. Gentlemen, thank you so much for being here.
Hi.
Greg, you've already hit the greens, haven't you?
I have.
We had a tough winter, but you made your way out there.
That is true.
Talk to me about your problem before you saw Dr. Carpenos.
Well, back in November 2013,
Okay.
I had been playing golf one day. It seemed pretty normal. Mm-hmm. I've dealt with chronic back pain for years, but I see Dr. Carpenos and he helps me. On this particular day, I played golf, went home that night. When I got off the couch, or attempted to get off the couch, I had a little problem.
You couldn't move? Is that
leg problem.
Okay.
And I stood up and I had a excruciating pain in my leg like I've never had before. It's something I'd never experienced in my life. So I ended up going to the hospital because it was that bad. Mm-hmm. And they really didn't help me much. But then I decided the next day, after I spent a night in the hospital, that I would go see Dr. Carpenos and talk about it.
And did you have an MRI? Did they do that?
Not then. I couldn't do it. I was in too much pain.
Really?
Yeah, they couldn't even put me in the MRI machine to do it.
So, doctor, what was the prognosis here?
So, well, the prognosis was it's going to take a while to get him better if we can. We actually did eventually have an MRI done, and he had a very unusual disc herniation where the disc, which is a shock absorber between the vertebrae, instead of just going out and hitting the nerve, it actually went out and up into the space above it.
Is that common or not?
No,
usually?
I had never seen it in my 20 plus years of working with disc patients. So I was not sure that we could even help him, and I took the MRI to a surgeon. Mm-hmm. The neurosurgeon looked at the MRI and she said, we have to operate on him. We'd have to go in from the level above, break up some bone, and go in and actually extract the disc from above. And I told him and his wife that that's what the surgeon said, and he said, can I help him? And I was about 60-40 that we'd get him better than he was. So he decided to
give it a shot rather than having the surgery?
Yes,
go for it.
That's what happened.
And it worked?
Yes. Fast forward before, he actually put me on this DRX machine, which I've never had to ever use before. And when he put me on there, I was in, like I said, the most excruciating pain I've ever been in my life. I mean, you're talking grown man almost in tears here. It was bad. And I remember what he said to me when he put me, you got to get harnessed into this thing. And he said to me, you're either going to punch me in the face or you're going to want to kiss me on the mouth. That's what he said.
Go one of two ways, I suppose.
Right.
Yeah.
So it was weird. It was like an exorcism. I mean, the pain immediately left my leg.
Wow.
Immediately. It was the strangest feeling. It just left. So for the next 20 minutes or so, I was in heaven. And then the pain came back when I got off the machine. But obviously, it figured out what the problem was because it was working. So we went through treatments for like about the next 10 days before I could do the MRI. That's when he saw what was going on. And I continued, I said, it's working, so let's continue the treatment. So we did.
And light cure also came into the picture?
Yeah, can't do one without the other. The laser accelerates the production of new disc tissue. It closes down the pain gates. It oxygenates the blood. It reduces inflammation, while the decompression instrument is unloading the disc and positioning it so that it's away from the nerve. So we do both in conjunction. The laser is ubiquitous for just about any soft tissue injury, disc problems, the knees, arthritic knees, plantar fasciitis, shoulder problems, elbows, neck and back. It's unbelievable. And it's quite simple.
And it doesn't hurt. I mean, you're not feeling pain through any of this,
That's right. We're going to protect
I'm going to put
baby
these
Do.
on? Okay.
And I'll just demonstrate quickly how it works. So basically, we're just putting the laser on and going up and down where the soft tissue is. So if you had, like, let's say you had tennis elbow, we would be over in this area right here. And it's just a very gentle movement. And the only
really
thing.
don't feel anything. It's kind of relaxing almost, right?
It is relaxing, very soothing, but it's just like photosynthesis. The warmth of the sun doesn't cause the production of energy in the cells. It's the light. This does photobiostimulation. The light from this wavelength of laser stimulates the production of new cells. So fast forward with him, he got back on the golf course in about 5 months, right?
Yep.
And that was a year ago. One thing people say, how long does it last?
Sure.
So he hasn't had the DRX in quite a while.
Wow.
And I plan on him being like this the rest of his life. Had he had the surgery, you know, maybe he'd be as good as this, but he could also be a lot worse.
We don't know,
Surgery
right?
is rarely indicated unless you're, you know, can't control your bowels, your bladder, or, I mean, really serious cases. But people go for the injections and the surgery when they just don't need it. So we'd love to see them first, obviously.
Makes a lot of sense. And Greg,
Yeah.
most importantly, how's your game now?
Good, looking good.
Top-notch.
He's a
All
single-digit handicap.
That's impressive. Doctor, thanks so much for being here, Greg. Thanks for sharing your
Thanks, Teresa.
story. And for more info on New England Spine and Disc, log on to their website, newenglandspineanddisc.com, or you can visit them at 391 Boston Post Road in Orange.
Yep,
Right?
and we'll give 2 free visits for everyone that calls, so
Very nice.
that'd be awesome.
We'll
We'd love
check
to
it
hear
out.
from you. Thank